MSNBC investigates extreme plastic surgery.
Reporting now, John Siegenthaler.
Nose jobs, facelifts, tummy tucks. They were once fairly radical operations, certainly not surgeries just anyone would have. Now, plastic surgery has become a $10 billion a year industry. It's common for patients to have 2, 3, even 4 or more procedures at one time. Like many women her age, Judith Boyd, a Los Angeles therapist, wants to look younger, to feel better about herself.
I decided on my 60th birthday, and my daughter, my only child, got married 2 weeks after that the rest of my life now belonged to me.
That's why, soon after her 60th birthday party, Judith decided to have plastic surgery. Lots of it.
I'm going to have this tightened up, and my neck and here, yeah. And he's going to lift just a little bit right in here because my eyes now are starting to sag just a little bit.
I'm making a note for me to pull this up.
Judith's doctor, Grant Stevens of Marina Del Rey, California, marks up parts of her body to guide him during surgery.
He's going to also do an uplift of my breasts because having aged and children and everything, they've sagged a lot. And one of them always been a size and a half bigger than the other. And that's bothered me since puberty.
So that looks like 30.
So he's gonna fix that.
So 35 and a half.
And there's more. Judith will have a tummy tuck and liposuction. In all, 4 plastic surgery procedures performed in the span of 3 days.
How much smaller do you suppose my waistline will be?
Oh, it's hard to say. A couple inches, though, probably.
No kidding.
Judith is part of a growing trend. 43% of cosmetic surgery patients now have multiple procedures all at once.
And we're also going to be suctioning your lateral thigh, which is these little saddlebag areas, which have come way down with your weight loss.
Before Dr. Stevens would consider operating on her, Judith had to lose weight.
I always laughed and said I was built for comfort, not for speed. And I weighed 185 pounds.
He told her what he tells other overweight people who want plastic surgery.
Take the money you would spend with me and get yourself a trainer. Get yourself a nutritionist. Let's have you lose some weight. You don't need my surgery. You need to just change your lifestyle.
And Judith did just that. She began a strict program of diet and exercise and lost 50 pounds in 5.5 months.
She's in terrific physical shape. She's been worked up from head to toe. She recently did a cardiac treadmill.
Left with sagging skin and wrinkles, Judith wanted multiple plastic surgeries more than ever. Dr. Stevens agreed to go forward.
This is surgery that you want, not surgery that you need. You need an appendectomy when you have appendicitis. You don't need a facelift. You want a facelift. So we work everyone up. If they have medical problems that would be contraindications for elective surgery, we don't do them.
Dr. Stevens also says it's in his interest as well as his patients to be sure that they are emotionally prepared for surgery and do not have unrealistic expectations.
We can't give you a new job. We might give you a new attitude, and then from the new attitude you get a new job. But we can't give you a new job. And I can't give you a boyfriend. You may feel better about yourself and you'll get a boyfriend, and we see that all the time. But I have people walking in thinking that if they have a breast augmentation they're going to get a spouse. That's not a good indication for surgery.
I'm not doing it for a man. I'm doing it for myself. I think there comes a point in life, I hope there comes a point in life to most people, to most women, where you stop doing things for men and you start doing them because they feel good to you.
Judith says she has spent years in therapy to overcome her torments and traumas.
I was a battered child, physically and emotionally, yeah. My mother was crazy. Her mother died when she was 6 years old. So my mother grew up in an institution, and she stopped growing up when she was 6. And she had no ability whatsoever to know how to take care of a child. I wasn't a human being. I was a doll. So as I grew up, and then I had to learn how to let that go.
Judith became a therapist and later a spiritual teacher. Along the way, she married and had a child. When she was 40, she divorced. 2 years later, she had her first facelift.
But I never really took responsibility for my own body. And I had cancer 3.5 years ago. And they removed all my female organs.
After surviving cancer, Judith began to pay more attention to her health and physical appearance. She had eyebrows tattooed on permanently and got an injection to make her lips look fuller. After deciding on her 60th birthday to remake herself, Judith had laser surgery to correct her vision. The culmination of her self-improvement will be her multiple plastic surgery.
Some people say, good for you. That's wonderful that you've decided to do this. You know, it's your life, and you ought to look as good as you can, and particularly right now. You know, other people say, oh, you don't need to do it. What a stupid thing to do. My God, and you're going to spend money to do this? And other people really have a horror thing to it and think that it's terribly hedonistic.
Judith says she had many a sleepless night worrying about her decision.
There's the money part. There's the whole thing about the recuperation part. There's the pain part. There's the will there be scars? How much of that will make a difference? And so I had to really resolve that.
Judith's 4 plastic surgery operations are costing her nearly $35,000, half of her life savings.
I mean, it's a big amount of money. And I have my hair cut once a year because it's, it's expensive. I have my car. It's 11 years old. I bought it a year old, 11 years ago. It still runs great. So it's, a huge decision.
Elective surgery is not covered by medical insurance, but Judith hopes to recoup some money by writing a book about her transformation.
I'm calling it From Frumpy to Fabulous, One Woman's Odyssey to Good Health and Vitality.